The respiratory anatomy is going to be looking at the tissues and organs that are going to be related to gas exchange and with vocalization. When we look at the gross anatomy of the system, we basically break it up into two distinct parts, sometimes referred to as tracts. We have the upper tract. The upper tract is basically the nasopharynx, which is going to include the nasal opening, the nasal cavity, the oral opening, and the nasopharynx. Within the nasal cavity, we have distinct bony structures, which we call the concha. The concha are going to become important when we talk about ventilation volumes and the way in which we can get air into and out of the system quickly. There is a soft palate at the back of the oral opening. That is the division between the nasal part of the nasopharynx and the oral part of the oral pharynx. And then we have the lower part. The lower part is basically going to be the tubes and the lungs, or the pleura of the system, which includes the larynx, the trachea, the bronchi, the bronchial divisions or bronchial branches, and then the lungs. The upper respiratory tract is made up of a tubular pathway that's going to allow air to enter from the external environment to get to the lower respiratory tract, as well as air from the lower respiratory tract to exit to the external environment. The tissues here are lined with pseudostratified ciliated epithelium with goblet cells to produce mucus, as well as stratified epithelium. It contains various sinuses. These sinuses allow for an increased area of air movement, which is beneficial for immune responses, along with ciliated projections to trap pathogens and move the pathogens that have been trapped from the lower areas up to the upper areas for expulsion. So if we look at the upper respiratory tract, we notice that we have various sinuses, such as the nasal sinus, the paranasal sinuses, such as the frontal and the sphenoid sinuses. Within the nasal cavity, we have three distinct conchal regions. We have the superior conchal, the middle conchal, and the inferior conchal, as well as the vestibule of the nasal opening, just superior to the nostril. These openings and these conchas cause a turbulent flow, a vortex, to develop with air movement. The vortex allows for faster air movement through the medius of the conchas to increase the rate of flow and thus the volume of flow through the nasal opening and into the respiratory tract. What this does is this allows for a greater volume movement in shorter amount of time. We have a separation between the nasal opening and the oral opening with the hard palate, the palatine bone, and the soft palate and the uvula in the aspect of the oral opening. Lining the soft palate and within the lower regions of the pharynx are various tonsils, such as the palatine tonsil, the lingual tonsil. These tonsils are part of the immune system and are responsible for expulsion of toxins and pathogens within the system. We also have to worry about the tongue, the hard palate, and the gums, and the lips when it comes to vocalization. The other thing we have to look at is the laryngeal structures here, that is the division between the pharynx and the lower respiratory tract. In this we have the epiglottis. The epiglottis is responsible for closure of the tracheal opening during swallowing reflex so that food material will head to the posterior tube in the esophagus and not the anterior tube, the trachea. If we look at the upper respiratory tract in response to the various pharynxes that are there, we have the nasopharynx, which is the area just superior and posterior to the soft palate, just distal to the conchas and the meatuses. The oral pharynx is just posterior to the epiglottis and just superior to the tonsils, and glossal. The anatomy of the lower respiratory tract can primarily be divided into two distinct structures. We have the trachea and bronchial structures, which are the cartilaginous tubes that allow for air to move from the upper areas to the lower areas. These tubes are cartilaginous and collagenous and are kept open by the tissue structures themselves, as opposed to the bronchioles and the alveoli, which are kept open patently by air within them. Additionally, we have two distinct structures that are responsible for things like vocalization as well as separation of the two tracts within the cervical region, the esophagus, and the trachea. We have the larynx. The larynx is going to contain the glottis and the epiglottis, which is important during the swallowing reflex so that we do not have food materials moving into the trachea. And then the vocal cords. The vocal cords are responsible for vocalization due to air vibration across the membranous units. When we look at the trachea and the bronchiole, what we're looking at is we're looking at cartilaginous structures, which are basically C-shaped, that are connected by annular ligaments and longitudinal ligaments. The cartilaginous structures are supported by what are called cricoid rings within the larynx, as well as the tracheal rings within the larynx. The cricoid and the tracheal rings are held in place by annular ligaments that allow for them to flex and move without displacement of the structure. So if we look at the structures here, what we have is we have the larynx. The larynx is going to have the thyroid cartilage and the cricoid cartilage. These cartilages are important when we look at vocalization. The thyroid cartilage is also the structure upon which the thyroid gland and parathyroid glands will rest. The cricoid cartilage is going to be responsible for anchoring of the epiglottis as well as anchoring of the vocal folds or the vestibular folds that allow for vocalization to occur. The thyroid cartilage can also be referred to as the Adam's apple. For females, there is a larger fat pad that lies on top of the angular part of the thyroid cartilage, which makes it less distinguishable than the male due to testosterone secretions. If we look at the histology of the trachea, we have on the posterior aspect a longitudinal ring of smooth muscle. This longitudinal ring of smooth muscle has a circular line of muscle just distal to it, or just posterior to it, I should say, in between the tracheal opening and the esophageal opening. These muscles are going to control the diameter of the trachea, either for tracheal dilatation or tracheal constriction. The trachealis muscle is one of the muscles that is involved with asthmatic responses due to irritation of the trachea and bronchial tubes. On the anterior aspect of the trachea, deep to the cartilaginous rings, are pseudostratified ciliated columnar cells, which are responsible for the production of respiratory mucus, as well as expulsion of pathogens trapped within that respiratory mucus. If we look a little bit closer at the larynx region, what we end up seeing is various types of cartilaginous structures. These various types of cartilaginous structures include the cricoid, the thyroid cartilage, the cornicoid, and the arynoid. These cartilages have membranous structures that attach to them that will either close or open based off of tensioning of muscles coming from the hyoid bone. The opening and closing of these folds lead to the ability to have vocalization patterns. The vocalization patterns coming from the vestibular ligaments and vestibular folds allow for us to have speech pattern. The speech pattern that we see is based off of whether or not we have an adducted or abducted opening within the folds based off of the positioning of the cornicoid and arytenoid cartilage, as well as the tensioning of the vocal ligaments and vestibular folds around the cricoid cartilage. When we have an abducted patterning of these folds and these ligaments, air is able to flow across them in true laminar shape, meaning there is no vibration of the folds. All of the air is moving at once. However, when we close these folds, air is going to move through small little slits within the vocal cords, causing vibration to occur. When we match these vibrations of the vocal cords with movement of the tongue and hyoid muscles, we're able to cause vocalization patterns. If you watch the videos that are associated with this on the vocalization, you will see the movement of the vocal cords based off of high pitching and low pitching, as well as letter formation. The robustness of the vocal cords will dictate the tone and depth of vocalization. You can change the tension within these vocal cords to change the tone of sounds being made. Additionally, if you overuse these vocal cords, small little inflammation polyps will form, sometimes referred to as vocal cysts. People who use loud sounds or high-pitched sounds are more apt to form these vocal cysts. The vocal cysts can be removed surgically, but must be accompanied with rest of the vocal cords, meaning the person is basically told to be mute